Good afternoon, everyone. Kind apologies for the slight late start. We are fully aware that the world is engulfed in a third wave of COVID-19 pandemic, and Sierra Leone is not an exception. As a matter of fact, there are some countries now that are talking about a potential fourth wave, fifth wave, as the World Health Organization and other instructive institutions have been indicating. COVID-19 may be with us for the longest haul. The National COVID-19 Emergency Response Center is a multi-pillar structure. It's an interagency structure. It draws personnel and best practices, institutional and structural, from a wide range of professional areas. And today we are pleased to recognize the fact that we have a multi-expert structure. We have experts in a wide range of fields who are here, and they are put at your disposal, our friends in the media, to respond to critical and emerging issues. First, we would have to have a presentation from the chairman of the National COVID-19 Emergency Response Center, Honorable Sheku Fantamadi Bangura, and then questions coming in will be responded to by our team of experts. Just for us to have a sense of the experts in the room, I would kindly ask our colleagues at NaCOVERC and the Ministry of Health and Sanitation to do self-introduction, your name, your designation, and the mandate of your pillar. So I'm sure that one would stimulate or prepare the minds of our journalists to frame questions as and when they touch and concern the relevant fields. So I may wish to start with Colonel Hassan Kumba, and then we'll take the rounds.
Thank you very much, Spokesman and Minister, Deputy Minister. So, colleagues, I am Group Captain Hassan Kumba. I am the Operations Coordinator at NaCOVERC. Short of my responsibility is to provide the enabling environment for the other pillars to conduct their activities in terms of operations, coordinating operations, and security. Thank you.
I am Professor Fodisa. I am the Technical Group Coordinator. I coordinate the activities of the various pillars in the technical arm of the response.
My name is Moses Bevao. I'm the laboratory pillar lead for COVID-19 response. My duty is to collect, transport, and analyze samples for COVID-19.
Yeah, good afternoon. I am Dr. Tom Cecil. I'm the pillar lead for vaccination, COVID-19 vaccination. So of course that entails ensuring that we have the vaccines in country and the vaccines are distributed and eligible populations are vaccinated for us to have the necessary level of population protection needed for us to end the COVID-19 pandemic. Thank you.
Excuse me.
Yeah, good afternoon, everyone. I'm Dr. James Sylvester Squire. I'm an epidemiologist and program manager for National Disease Surveillance for the Ministry of Health. Epidemiologist and program manager for the National Disease Surveillance, Ministry of Health, and part of the surveillance program.
Good afternoon, everybody. My name is Harold Thomas, Risk Communication Lead for NaCOVERC. My duty here is to communicate risks and event information and to give sound and accurate information in order for us to influence attitudes and increased knowledge.
Yeah. Come there, sir.
My name is Alfred Jamiro. I'm the lead for social mobilization. My pillar serves as the forerunner to all of the other pillars in the area of sensitization with the hope of changing behavior. Thank you.
Thank you. My name is Mohammed Haji Kela, lead for psychosocial, also Deputy Minister for Social Welfare.
Yeah. Dr. Van is the name. I'm the Director for Health Security Emergencies in the Ministry of Health and Nutrition. At the same time, the Surveillance Pillar Lead at NaCOVERC.
Hello everyone, my name is Michaela McKay, the Chief Operating Officer and Director of the SDI. We provide ICT support to the response, working with local and foreign ICT experts.
Good morning, everybody. I'm Ria Spencer, Strategic Advisor, Public Information, NaCOVERC.
Good afternoon. My name is Alpha Khan. I am the Strategic Advisor for Social Mobilization and Food Security at NaCOVERC.
Thank you very much for the introduction. And as I said, we recognize the presence of the distinguished chair for the National COVID-19 Emergency Response Center, Honorable Sheku Fantamadi Bangura, who will be doing us a key presentation. After his presentation, we would ask the respective pillar leads that are here to do 1 minute brief each. Following the presentation of the chair of NaCOVERC, the respective pillar leads will do 1 minute presentation each. Just a 1 minute brief on the respective pillars, and those ones would inform the questions, comments, or suggestions that will come from the floor. Without further ado, I wish to give the floor to our distinguished chair, Honorable Sheku Fantamadi Bangura. The floor is yours, sir. Thank you.
Thank you, Honorable Son Jamiru. And thank you all. Thank you for the states. Thank you, colleagues. We are very pleased to brief you again. We've been doing this very regularly in the response, but I think this is a critical moment that we must bring to you clarity on where we are in terms of managing the third wave, which we at onset of the month of June had been experiencing in the country. I must say, as I speak as of today, we have actually bent the curve on the third wave. And what I mean by that is when we look at our epidemiological curve and data, we are seeing decreasing number of positive cases in the country. And that we have been observing way back, I would say, since the end of June. But as you will know, how did we get there? I think it is very important to get to where we are. We are seeing decreasing number of hospitalization. We are also seeing the death levels are not as high. We've been having, on average, 1 death, but sometimes 0 in the course of a week per day. That's not too alarmist, but it's something that we are watching very critically. We started off the alerting on the third wave with a surge. When we noticed slight rises in cases early in June, as a response, we surged our operation. We increased on the number of testings that we were doing on a weekly basis. We're doing an average of 3,500, but that got ramped up to an average of over 5,500 on average per week. And what that did to, and then we followed up that with measures. to alert the population to adhere to the COVID-19 protocols of wearing face masks, social distancing, and ensuring that you pick up the hygiene protocols themselves. And what we saw is we pushed the curve right to its peak, way at the middle or towards the third week in June, where we had the 114 cases in the country. But because of those measures, we'd actually followed through once we hit the peak. We were not very sure about whether that was a true peak. We actually followed through with additional measures and clear pronouncement from His Excellency around curfew, limiting movement of people, and ensuring that also we stop what we call super spreader crowd gathering activities and puts further bans on enclosure facilities, be they bars or clubs and the like. And then what we have seen towards the end of the month, second week in July, we plateaued the curve itself. There we saw the need to do what? Additional enforcement. And what we have seen in the course of all of this period leading to the middle of July is a complete epidemiological curve that has gone through a full quadratic behavior. What we are trying to do now is to ensure that we deepen our enforcement, we deepen our measures, and flatten that curve. As I speak, you will notice in the last couple of days, we've been hitting single digits on the case. We hope we should be able to keep that going, and that is the essence of the response. There are key indicators that are looked at internationally. One of them has to do with your positivity rate as a country. And WHO, what they do is they set a threshold of 5%. And we observe that very keenly as a country and ensure that we try and push our positivity rate relative to our test around that, below that figure. And as a country, what we have been looking at, in fact, is that rate which we have seen it peaked around the highest number that we had, which is 114, around 10.2%. But that one has been coming down as I speak for last week, because we actually calculated on a weekly averages. It's about 3.1% now, way below the WHO threshold, which I think should give us some respite. We'll be looking at the daily positivity rates themselves in the country, where you will look at that to see whether your curve is actually flattening or actually going upwards. And what we are seeing is that this curve on the daily positivity rate in Sierra Leone has been flattened and is flattening actually. So what you want to do is to suppress it and bring it down, right? So as I speak, as of even the 17th, we were below 2% positivity rate around that, around 2% positivity rate, which is what we have set as a threshold for ourselves. And the reason being, we want to ensure that our facilities, our capabilities are amenable to the way cases are actually emerging in the country. So we are confident that we'll be flattening, we are flattening this curve, and we must maintain it that way. We'll be looking at other forms of indicators to observe where we are in the response, where they call the incident rate, the 28 days incident rate per 100,000 population. Sierra Leone is not among the list of countries internationally that are deemed to be with high transmission rate, which is if you have any above 100 during that period, or 100 and 500, within that period you'll be deemed to be high transmission case, or you're having increases greater than 50% in the last 2 weeks. So we have seen, we are not among that list of countries at all as a response. And we currently are very confident that the way we have been calibrating the response, we are in a space where we must ensure that we deepen our interventions in terms of the measures that we have, make sure that there is enforcement, you engage different stakeholders to enforce. On the vaccines, we do have vaccines in the country, and we have deployed the vaccines that we have, AstraZeneca and Sinopharm. We are encouraging the public, just like we did when we nudged the public, we are encouraging the public to take these vaccines. The vaccines are deemed efficacious and they meet WHO standards that we have in the country. And we encourage our people to take the vaccines. Two arsenals that we have to fight the virus. In Sierra Leone, we have gone through wave 1 and we have gone through wave 2, deploying our public health architecture, both in the way NaCOVERC is structured, ensuring that the command control operations are effective, but also ensuring that the public health interventions are robust. And that's what we used to go through wave 1, that's what we used to go through wave 2, and now we are going through wave 3 with the same measures. However, the second arsenal that we have is the vaccine. And that's why we encourage, but the vaccine in our space, the vaccine is something that we think Sierra Leoneans must take. And we encourage you to take the vaccines that we have. We do have Sinopharm, and Dr. Sise will speak to it. We do have Sinopharm in the country, and we are making every effort to ensure that we increase the stock of AstraZeneca that we have. So I will want to leave you with that brief introduction that one, our hospital levels, bed hospitalization is low, and we have capacity to be able to surge or ramp up should we have increases in cases. We have been opening many facilities in the country. Should there be any change in the dynamics to be able to respond? There are talk around oxygen to support our case management. We have oxygen in the system to support our hospital under the current circumstance. And we are trying to improve on our result disclosure and use our surveillance team to ensure that whoever tests positive, we're able to contact trace your primary contact. We've been improving on that, especially during the third wave. We've been improving on that, and I think there's a lot of slack that we have actually covered or squeezed out of the system. So that's where we are. I just want to stop there and tell the public that this corona is here, corona is in the world. It's not unique to Sierra Leone. The wave that we are going through is the wave that several other countries in the world are going through. Luckily for us, we've been able to put the third wave, sincerely under control, but we are still not out of the woods. We'll still have the possibility of another wave hitting. So the only way you protect yourself, take the vaccines that are in country and ensure that you abide by the protocols that we have said. Mask up, social distance, avoid what we call mass crowd, which are super spreader events, and ensure that you follow hand sanitization. Let me stop there. I have technical people in the response that are advising each and every pillar. They should be able to speak to anything that I've missed out in terms of where we are. But as you see, Sierra Leone was here listed and all of those things. All of that is something that we are handling diplomatically. Because as far as we are concerned, the nature of the virus and where we are currently, we believe that the data doesn't tell us that we are in a red situation or a red state, right? So we are engaging internationally to ensure that that particular position is actually reviewed. So let me stop there, and I want to thank you very much. Our colleagues are open for questions after they have given their initial statements and contribution. Thank you very much.
Thank you very much, Chair. Thank you very, very much. So that gives us sufficient indication as to where we are in the fight against COVID-19, and also to indicate strongly that the measures as announced in the broadcast of His Excellency the President on July 1st are working. It is now our responsibility as Sierra Leoneans to make sure we fully cooperate so that we don't just deal with the third wave of the pandemic, but the pandemic generally. A significant hallmark of the efforts to address the third wave and the pandemic generally has to do with surveillance, our track and trace efforts. And there is somebody who's very competent to speak to our surveillance efforts and perhaps some other things that he would consider relevant to the process. And that is Dr. Vandy, the Director for Health Security and Emergencies. Dr. Vandy, you have the floor.
Okay, thank you very much for giving me this opportunity to discuss what we are doing as surveillance with the response. As it was put earlier by the previous speakers, surveillance is the forerunner for any response. Surveillance tends to break the transmission chain. That's why we trace and track positive cases. We give information to other response pillars as to what decision or what action to take next in order to break the transmission chain. We have been in this from the beginning. because of our surveillance strength in this country, Sierra Leone was the last country in the sub-region to record a positive case way back in March 2020, 30th March 2020, when our neighbors have already recorded cases about a month. But even with that, people are saying, oh, we are lying. We are not lying. That is our strength. We have a very strong surveillance system in country. After the 2014-2016 EBD outbreak, frantic efforts have been made with support from the government and that of our partners to build a system, a resilient system, to be able to pick cases as early as possible. We have early warning system instituted in this country. We have community health workers in every community across the country. These are the ones who pick information on diseases across the country through the health system that we have established. We have immediate reportable events like maternal death, like EVD. These ones are reported immediately through the EIDSR system, electronic integrated disease surveillance and response system. We also have instituted ECBDS, integrated case-based surveillance. So these are all systems that we have put in place to ensure that we have early warning system in country, to give us that leverage. The data the chairman presented here is collated by surveillance. We review that on a daily basis, and we also share that data with across the sub-region. It is mandatory that we share that data with the ECOWAS region. We also share it with other international bodies like WHO, like CDC. So they see all of this that we are doing. The surveillance infrastructure in countries also comprising of partners, both local and international. We have CDC, we have WHO, we have AFINET, all of them are part of it. So what we are doing is credible. It's credible. I'm one of the authors of the survey that was done regarding the surveillance that was published recently, and that has created some problem with some people in the community, in the country. Before that surveillance was done, there was a reason for that. COVID is one of the most, in fact, if not the most protracted pandemic that we have experienced for decades. This is the second year. And when you have a protracted pandemic of this nature, it creates a lot of problems. This has put to test every system, both weak and strong. We have seen how the American system handled the COVID case at the beginning. We have seen how other countries are handling the COVID. There is no one size fits all approach to this. Every country has their own approach to the response to COVID. Before that survey was done, we had wanted to see what is the true prevalence of COVID in countries. So they tried to do a survey in Uganda and Tanzania. Well, it was limited to the mortuary. They were only testing corpses. So they came up with some interesting figure that they are seeing more positive cases among dead bodies. So it implies that there are more cases within the larger community that they are not seeing. So that information was made available to the response in those countries to take appropriate actions. African CDC approached us that they want to do a nationwide representative survey. So Sierra Leone is the only country that have done a nationwide serosurveillance survey. We are the first to do, according to what we were told by Professor Eugene. We are the first country to do that. So we embrace it, myself, my colleagues at EOC, we informed NaCOVERC, we informed the Minister of Health and Sanitation. We went through that. And the report that we got, which has attracted attention, is that, NaCOVERC have been underreporting. And this is what people are magnifying, and this is what people are making a lot of hue and noise about, that NaCOVERC have been not reporting the accurate figure. That is not the case. What the survey was saying is that it was nationally representative because we took samples across the country with help of Statistics Serra. We were able to go to almost every the various zones that we selected. We sent people out to collect data from there and to collect it. So this data was collated, and the observation was that it appears as if 48%, more than 48 times of the cases that they have seen in those communities is not what that we are reporting here. What does that mean? People are exposed to COVID. That was in March. People are exposed to COVID. And the asymptomatic cases, they usually take about a week for the virus to disappear in the system. A week. So if somebody is exposed at that time of the survey, 48, somebody is exposed to that. And they are now saying we have more, we are underreporting because they are saying we're supposed to have 48 times more cases than what we are reporting. That is not what the survey is saying. The survey is saying people have been exposed to it, they have antigen, they have antibody to the virus. That doesn't mean they are carrying the virus now. But they were exposed at some time along since we have the outbreak. They were exposed along the line, but that doesn't mean they are now carrying the virus correctly. That does not what the survey is saying, because I'm one of the authors of the survey. But what we were saying is we needed to do more testing, and that is what exactly we are doing. Now, the government have ordered for more RDTs that can give us the leverage to expand and do more testing across the country. We are asking for vaccination because the only way out to control this pandemic is to vaccinate your population to at least to get a herd immunity. Because if you can see Britain reopening their economy now, it's as a result of the fact that they have succeeded to vaccinate more than 80%. So they have got the comfort, the leverage now to open up. Even though they are getting cases, but those cases are not linked to hospitalization. But that's what they are telling us. Even though they are getting more cases, but they are not as serious to be hospitalized. And that was the fear. So if you only have the virus in you, you are asymptomatic and you are not hospitalized, because this virus is going to stay with us for some time. Not that we are going to eliminate it completely. It's going to be another Lassa fever that will be surveillance. It's going to be like even EVD. We are surveillancing Ebola up to today. We are surveillancing Marburg, which has not caused any outbreak yet. We are surveillancing Bombali Ebola virus that we discovered in Bombali two years back. We surveillance all of this on a daily basis. Not that they are here now, but we don't want for them to take us unaware. So we surveillance them. Likewise, COVID is going to stay with us for some time, and it's going to be on our surveillance list. We're going to surveillance this for a long time to come. So that is what we know. As from surveillance point of view, it is not going very quickly. This is the second year. We know it's not going. We only need to control it, and that's why we have convinced the government. We have convinced NaCOVERC that the way forward is vaccination. We need to vaccinate more people. We need to encourage more people to take the vaccine. Because we have seen the example now with England, we have seen the example in some countries in Europe, that if you vaccinate your population to a level that you have created herd immunity, you can open on the economy. You can open on it, because we're not going to wait to get rid of the last virus because we can open up. No. So we're moving in that direction. More testing and more vaccination. And that is the way the NaCOVERC is moving, and that's what we have advised government, and we are moving in that direction. Thank you very much.
Thank you very much, Dr. Vandy, and it's good you touched on the serologic study as well. For those of us who are following the international media, I'm sure we are privy to reports from India that is suggesting that 2/3 of Indians had actually developed antibodies. This is a new finding that has come out. So it's not just in Sierra Leone that you're having serologic studies. Chair, I recall in May last year, Kenya did one. Around May 30, Kenya had reported about 2,093 cases. Once the serologic study was done, it indicated a 4.3% seroprevalence, which was suggesting 1.3 million infections. In UK, the British Medical Journal also put out a study recently indicating that long COVID cases were being underreported in the records of the GPs. So it's not just in Sierra Leone where you're having serologic studies. This seems to be an emerging practice in most parts of the world. But what is important is don't just look at the finding and you conclude that, hey, NaCOVERC can be done the life away. No, we've run a very transparent system. Our figures are out on a daily basis. And as Chair has said, this is the pledge that we made. We made a pledge to the people of Sierra Leone that once we're dealing with the pandemic, there are some things that we have to jealously guard. And so transparency, accountability are some of the important hallmarks that will continue to define the response all the time. I wish to bring in Colonel Hassan Kumba, the lead for operations pillar, on whose shoulders rests the responsibility to enforce the measures as pronounced by His Excellency the President on July 1. Colonel Kumba to talk to us about operations, and after that we'll bring in Professor Givao to talk to us about testing. Thank you, Colonel.
Thank you very much, Spokesman and Deputy Minister of Information. So just to quickly take you through what operations coordination has been doing since the inception of the virus and what we are doing currently following His Excellency's pronouncement. So this operations coordination, what we do, we take information or advice from the technical coordination, that is the technical people, the experts, and send that information into the Presidential Task Force. When once the Presidential Task Force gives directive for measures to be adopted, that is where we come in. We operationalize exactly what was advised and the measures that we are to take. So you will see we employ platforms like using the security sector. We bring in the police, the military, the intelligence, that is the Central Intelligence and Security Unit, and even the Office of National Security. So we bring them into the operation, we coordinate the operation with them and put them on the street. We also use the ICT platform to make sure, for example, as you may be aware, we have applications like the Curfew E-Pass, where we give passes to eligible people to be in the street, so that we have the curfew enforced. Additionally, we have been seeing lockdowns, restrictions issued out from time to time. This is wherein this coordination is done with all the pillars, and then we enforce the lockdowns. We make sure people don't move. If it is required that people don't move, we make sure people stay home. If it is required that they stay home. So this has been happening. Again, we have been seeing the compliance enforcement management system task force teams. You see security sector personnel in the streets asking people to abide by the enhanced measures, which is very key to this operation, because sometimes these measures are coming from the technical people, the experts. They have seen that these are the ways by which we prevent ourselves, so we are there to make sure they happen. Additionally, we coordinate operations at the airport, the seaport, and the border point of entry, whereby we make sure that before people come in, they are tested, especially those at the airport. Our passengers coming through the Freetown International Airport, we make sure that each and every passenger that is coming in or going out, they are tested. We make sure those coming in, when they come, their status, we determine how and where we keep them, whether we release them or if they are of concern, then we keep them for training. Then we also provide, we look at the security at quarantine homes, treatment centers, community care centers, and even the recent rolled out vaccination program. So we provide security at those locations to make sure that insecurity issues are taken away from the response, and we make sure we do seamless operations. So recently, in the third wave now, what we are doing is enforcing the restrictions or the measures that have been announced. In doing so, we have revised the strategy. We are looking at engagement and enforcement. With the engagement, we want to make sure we engage the public. We want to make sure we localize the fight against this virus. We need people, you sitting here, even the village, those in the villages, each and every member of Sierra Leone, we want them, or citizen of Sierra Leone, we want them to be incorporated into this response. Because we have realized that the denial is still a challenge, it's creating a problem. So we think that engaging the populace, engaging institutions will be key in doing this. So for example, we are going to use the police heavily. They have structures in place. They have the police community programs. They have their partnership boards. They have the road transport sector, transport management, where they have traffic police. For example, there's a restriction on number of people that we process in funerals. So we want to make sure if people are passing, and for example, there's a traffic police that has seen more than 50 people, they can alert us. It could be a security layer so that people are informed. So as well, we are calling on the public. You please call us if you see the super spreader events, if you see more than the prescribed number of people processing with the funeral, we'll be grateful to have you. In fact, today, just after here, we'll be having another meeting with the Freetown City Council. Next, we'll be going to Ward C, that is the Western Rural Council, so that we engage them to help us with their structure. We plug into their system to make sure that when people come to ask for burials, they want to go to cemetery, even the security at the cemetery is involved in this response, by which way they will alert us to say, okay, you have given for 50 people to come, but we now have more than 50 people here. We can give them the authority to make sure not more than 50 people enter. So these are the steps that we have put in place. We want to make sure that this is integrated into our communities. We are going to use our risk communication and social mobilization. They will speak to that, but we are now looking at enforcement and engagement. Thank you.
Because we don't have the luxury of space, perhaps the other speakers would wish to talk from the mics that are with you. So let's hear Professor Gebau on labs. After Professor Gebau, we'll hear from Michael McKay on technology and Dr. Tom Sise on vaccination. Professor, please.
Yeah. Thank you very much. Good afternoon. Our duty is to determine through testing the presence or absence of the COVID-19 virus. That's all we do. We test different, we collect samples from different categories of people. We collect from alerts, people who are experiencing symptoms of COVID-19. These alerts go through 117. We are called upon to collect the samples. The next category is their contacts. And then if you are positive for COVID-19, if you are admitted, before you are discharged, you are tested again to prove the absence of COVID-19. Apart from that, we organize genomic sequencing to actually know the type of COVID-19 we are dealing with. And that was how we were able to determine that the Delta variant was in Serra Leone. Testing is done in 6 laboratories in this country, 4 in the western area, 1 in Makini and 1 in Kenema. We actually use what we call the gold standard. It's a PCR. In medical terminology, it's called polymerase chain reaction. We have a turnaround time from the time we collect the samples to the time you get your result is 48 hours. That's our turnaround time. I think that's about all. That's what we do. We give out the results and we facilitate patient management. Thank you.
Thank you. Can you kindly switch it off, bro? Continuously press it to switch it off. Thank you, sir. Stella.
Thank you very much. As mentioned in my intro, PSTI provides ICT support to the response. So based on the needs, we come up with systems and solutions to see how we can improve the effectiveness and efficiency of the response. So thus far, again, some of you are fully aware of what has been done to date, but just as a recap, even the government information portal, *468#, if you go to that portal, simple USSD, you have access to COVID-related information, updates, symptoms, and tips. And this was also make sure we get rid of the fake or false news that's in the public domain with regards to COVID-19 virus. We have also worked with all the partners to see how we can upgrade the systems at 117 call center, because prior to COVID, it was an emergency call center, but we had to see how we can enhance the capacity to be able to take on the additional workload that they had. During lockdowns last year, the STI, again with other partners, we supported monitoring of the lockdown, where some of you actually did see drones in the air to be able to advise governments and make sure they make this informed or evidence-based decisions on further lockdowns that could happen and whether or not we can actually sustain lockdowns for more than 3 days. We actually work with mobile network operators and using core data records, aggregated data. We analyze this data to be able to understand mobility, especially mean that the western area was the epicenter, to understand movement and see potential spread of the virus and how we can work with the respective pillars to curtail the spread. Colonel Kumba mentioned they're in charge of compliance, so we work with niche technology to see how they can roll out SIMS as a compliance management system, where if you are in default of the protocols and you have to pay fines, how these fines are monitored real time. Now again, for homes that are quarantined, it's also important to be able to monitor services that are being offered at these homes. So we supported the response by developing the quarantine app. As I speak, training is ongoing in Western area, rural, where supervisors from both surveillance and quarantine team are trained on how to use this application, registering the homes as and when a positive case is detected, or even if they're primary or secondary contacts, being able to monitor psychosocial and other medical support services that are given to members in these quarantine homes, up or to when the home is collapsed as a quarantine home and they're all allowed to leave, provided they're all negative. Most importantly, the response is responsible for monitoring travelers in and outbound of Sierra Leone. So we're working with a company called Fixed Solutions to operationalize the travel portal, travel.gov.sl, which records and registers inbound and outbound passengers coming through the international airports. As I speak to date, we have, to be precise, 109,956 passengers that have registered on that portal. A couple of weeks ago, I did come here where I actually informed that we were launching the *1919#, and that's used by swabbers to record the point or time swabs are collected for international travelers. What that does is feed information directly into the portal. At the instance the swab is collected, the swab goes to the labs, and when the results are released by the admin center at EOC, provided they're negative, the passenger is able to access their e-certificates and they're ready for travel with the certificate downloaded on their mobile phones. So there's several ways we support the response. Very soon we'll also be launching, based on approval from labs, another solution where any other person, the subject, the data will be collected real time at points of testing, whether it's antigen or swabs, and also the results will be released real time. This all adds to the efficiency of the response and makes Sierra Leone also unique in its own way of addressing the challenges as and when they come. Thank you.
Thank you very much, Michaela. So we'll now bring in Dr. Tom Cecile on vaccination. After Dr. Cecile, we'll bring in our two strategic advisors on public information and social mobilization. And Professor Fodisa may wish to say a word or two on any technical issue perhaps that we have not been able to speak to in a minute. Dr. Cecile.
Yeah, thank you very much, Honorable Minister. Thank you very much, Mr. Chairman. Yeah, so earlier on, Dr. Bandi said that surveillance is the forerunner of the COVID response. We all know now that conclusion of the COVID response is through vaccination. If we want to open up the country, if we want to continue to do the things that we used to be doing, we need to ensure that we are adequately vaccinated as a country, so that everything can resume normal activities. Of course, as the vaccination pillar, we are providing vaccination services across the country. Of course, at the moment, we have 72 vaccination teams. We are planning to expand that significantly so that we can, increase the reach. We've been able to vaccinate 135,000 people with the first dose, and that's 2,607 have received the second dose. We are currently using 2 vaccines in the country, that is the AstraZeneca vaccine and the Sinopharm vaccine. Of course, you all recall that we received 96,000 AstraZeneca vaccines from the COVERC facility, which was due to expire on the 16th of July. I'm happy to report here that all of those doses have been utilized. Of course, we would have paced the utilization of the AstraZeneca vaccines, but because they are expiring on the 16th of July, we had to expedite the utilization of those vaccines. Of course, we had also received 42,000 doses of AstraZeneca vaccines from the African Union. These are vaccines that were originally procured by South Africa, but because they were not effective against the South African variants, South Africa donated those vaccines to the African Union. And you all know, those processes, the bureaucracies involved in doing those donations, and from the African Union, African Union donated to a selected number of countries. We were one of the countries that benefited from those 42,000 doses. They arrived in country on the 20th of March, and they were due to expire on the 13th of April. So there was no way we were going to be able to use all of those vaccines. But we utilized 29,000, and 13,000 of them we could not use. So those vaccines are quarantined and for disposal at a later date. So at the moment, we have Sinopharm vaccines, and these vaccines are effective, they are efficacious. We know that normally when you compare vaccine against vaccine, in terms of efficacy, you may have one that is 80%, 85%, but any vaccine that has an efficacy above 60%, I think has a very good benefit in terms of population immunity. So we're going to continue to encourage people to ensure that we receive the vaccines. At the moment, we are working with international organizations. Even His Excellency, the President, retired Brigadier Julius Malabio, has been part of the advocacy to ensure that we get AstraZeneca vaccines earlier than the expected arrival date, which is in August. But a lot of advocacy is going on to ensure that we are able to get AstraZeneca before that date. Recent evidence is now emerging that even the Sinopharm vaccine can be administered even to persons over 60 years of age and people with comorbidities. Before now, we were limiting the Sinopharm vaccine only to people who are below 60 and people who do not have comorbidities. But now there's no excuse not to take the Sinopharm vaccine because the evidence now shows that it can be administered to all of those target populations. I want to remind all of us that for us to be protected, we need to have the 2 doses of the vaccines. So for all those who have received first dose, you need to ensure that you try and get the second dose. Have in mind that there's a global rush to get these vaccines by all countries. It's a highly competitive space. So when vaccines are available in country, we need to make use of that opportunity to try to get ourselves vaccinated as early as possible so that we are properly protected. We're having some preliminary data showing that there are a lot of benefits we are getting from the vaccine that are being administered in the country. Looking at some of the data from about 1,340 positive cases in the DHIS, out of 1,340 that are positive, 1,290 had not received any vaccination, right? And only 26 had received 1 dose of the vaccine, whilst 8 had received 2 doses of the vaccine. Only 4 of the positive had received 2 doses more than 2 weeks earlier. So this is preliminary data. A lot of data analysis is going to continue going forward. But you can see that the overwhelming majority of positive cases that we're getting now are amongst people who are not vaccinated. So we want to encourage people that the vaccines are effective, and I think we are getting the results that we are expecting. Of course, we are encouraging the district level, the NaCOVERC, and the DHMTs to step up in utilization of vaccines, because we know some districts like Kaila and Kenema are doing extremely well, and we always want to commend them. We have some districts that are now, vaccination seems to be tailing off. We want to encourage them to step up so that we ensure that our people are adequately vaccinated. We are planning on expanding on the vaccination sites to 300 so that we have 300 vaccination teams across the country. And just to ensure that as we are expecting additional vaccines in August, unfortunately we'll be having a wide range of vaccines in August. We want to ensure that we have enough vaccination sites to ensure that we utilize all of those vaccines. So thank you very much, and we look forward to your advocacy, support, and joining us in mobilizing to ensure that our population is adequately vaccinated. Thank you.
Thank you very much, Dr. Tom Sise. So we have two strategic advisors with us on public information and social mobilization. And we believe that engaging communities and communicating risk is very important in a pandemic. I would have loved Harold and Alfred Jamiro to have spoken on risk communication and social mobilization, but for the fact that we have those strategic advisors with us, we'll let them do the honors. And so Dr. Julius Spencer, and after you, Alhaji Al-Fakan. Professor Serra, would you wish to, at some point, make any intervention? After those two speakers. Thank you. Dr. Spencer, please.
Thank you very much. I'll keep it brief. Basically, the public information part of this response has been probably one of the most important. You'll be aware that a lot of information is put out. We started off with daily press briefings. They were reduced from daily when the pandemic went down. A lot of information is out on social media. We have a group of people we call Corona Pet Ambassadors, about 50 of them, that we have engaged so that they can help spread the message. But perhaps most important is our coordinating efforts. What we want to be able to do by the end of, by the end of the pandemic, the virus will still be around, we believe, is that there should be systems in place that can be utilized in future pandemics, because everybody knows across the world that there are going to be other pandemics. Ebola came and went, and the systems that were left behind were basically challenged when COVID came. In terms of information now, we have built networks with all the districts. We even have weekly online meetings with the risk communication, social mobilization, public information teams in every district, so we can coordinate what they are doing, their activities, and we can get feedback. We are doing monitoring of the media, we are monitoring rumors and misinformation. We have a system in place which gives us an indication of what is going on, what people are talking about, the wrong information that is going out, and we're making efforts to counter them. So a lot is going on. I believe that the public information and risk communication and social mobilization cluster of pillars is being taken very seriously by NaCOVERC, and our activities are going to receive significant funding so that we can ramp up our response. We've got assurance of that. So in the next few weeks, you are going to see that part of the response ramping up, because we believe that this pandemic, in fact, the evidence shows that it is probably one of the most difficult that the world has faced. And one of the biggest challenges now we're talking about infodemics. Basically, the false information out there is so much that people are confused. Across the world, it's not just Sierra Leone. So we are making frantic efforts to be able to counter that false information so that people get the actual information they need so that they can make informed decisions. Thank you.
Thank you, Dr. Julius Spencer. Alhaji Al-Fakan.
Thank you, Mr. Spokesman, Mr. Chairman, and all of our colleagues in here. Good afternoon. What we do is to encourage people to prevent themselves from getting sick. As they say, I think the very first basic principle of medicine is that prevention is better than cure. And if you prevent yourself, you won't have to give the doctors so much work. So far, we have been lucky in Serra. We have about 6,300 cases out of 7 million. It's less than 0.1% of the population. What we have, that is an emergency for us in social mobilization. And the rest of us, you, me, and all of us, over 6,999,000 people that we need to fight to keep safe. And we can only do that if we cooperate with you. The press, politicians, the traditional rulers, the headmen, the youth, and everybody that is out there is a social mobilizer. So we'd like you to help us take the message across to the people that this disease can only be defeated or avoided if you continuously wear your face masks, wash your hands, and keep social distance. And also, if you back it up with the vaccines, as Dr. Vandy and Dr. Tom Sisi have said, that will help us. Because the doctors have said and they predict, and when they talk, sometimes you have to know. They say there's going to be a 4th and a 5th and a 6th wave. All of you are familiar with Lumley Beach. Anytime you go there, you see the waves coming. There will be a big swelling. It will break, but another one is coming. What we are doing in NaCOVERC is to try to rectify those waves, so that we keep the troughs low, and, like Chairman said, to bend the curve. Once we bend the curve, we'll then maintain parity. And when we do that, even if the pandemic stays with us, the corona stays with us, it will not come to the proportion of a pandemic, because we've been able to break the outbreak. So that's what we do in social mobilization. Let the people know that the responsibility for you to stay alive, and also for other people to stay alive, is for us to observe the precautions that have been put across. So thank you very much, and I hope you will continue that. It's a responsibility as patriots and nationals of Sierra Leone. Thank you very much.
Thank you very much, Alhaji Alpha Khan. I also wish to acknowledge the presence of Darlene Yema Thompson, the Managing Director of Serra. And Yema was actually the person who helped us put through that fine team of about 60 Corona Fet ambassadors we call Shia for Mama Salon ambassadors. Thank you very much, Yema Thompson. So we listened to Michaela McKay when she was talking about one of the beautiful things happening in the response is the fact that we have been able to design and deploy technology throughout. So when there was resumption of commercial flights, when we lifted the restrictions, then for the second wave, we were able to set up the travel portal, www.travel.gov.sl. So we're seeing incoming and outgoing passengers, and I'm sure at the start, Sierra Leoneans were deeply concerned. Will NaCOVERC get this right? We have been able, under extreme difficult circumstances. So I would want to bring in Honorable Mohammed Haj Kella to talk about how the interventions at the Freetown International Airport have been able to address some of those things, and now that we have the systems working. Honorable Haj Kella.
Thank you very much. Our role at the airport in terms of NaCOVERC is really trying to operationalize the architecture that was set. You would recall that there were quite a lot of glitches when we started the response in terms of actually making sure that we gatekeep, if not try to prevent the virus itself from actually filtering into the country. What that meant was that we needed to make sure that every traveler coming through our point of entry, particularly the Freetown International Airport, must be tested or screened and then allowed to come into Freetown. So far, on average, we are receiving about 1,020 to 30 passengers every week coming into the country. And what we do at the airport is to ensure that all of them are screened through our portal system, as well as actually making sure that they are tested. In the beginning, people were a bit questioning, would we get this right? What we have done so far is to ensure that we put the right system in place, and we put the right capacity of people that will be able to manage that process for us, right from the lab process, making sure that the operation is right, ensuring that those who come through our testing are fully briefed, psychosocially ensured. Once they have received their test results, if they are with the RDT, the rapid response test that we're using, in the first instance, if they are not reactive to it, then we allow them to proceed to preterm whilst they await their PCR results. If they are reactive, what NaCOVERC does, we do have our holding centers that are very clearly put, well measured, and of course anyone can stay there without any cause to say, well, this is not good, we don't have this, we don't have the facilities. But when they are reactive, we keep them in our holding centers, which will be at their choice. If they want to go to hotels, then they can go to the hotels. So far, we have expanded on our testing facilities at the airport, using both sides. Those who may have gone through the last couple of weeks, you will see that there have been quite a lot of improvement there. And I would also like at this juncture to also let you know, as part of our legacy, strengthening our health system, we are actually putting up a structure, a testing facility, which will be able there to manage quite a lot of work, particularly when it comes to testing. So far, we have worked with the airport management, NaCOVERC, and of course other partners to make sure that the passenger experience is really a real one, and people are not actually crowding or clustering in our testing. Some of these pictures or frames you might have seen on the social media, that is now a thing of the past, but things are working well. So thank you very much.
Thank you very much, Honorable Keller. Brigadier Professor Fodisa is the technical coordinator in the response. He may wish to add one final layer to the technical brief that has been provided. After that, we'll be pleased to take your questions. Brigadier Professor, please.
Thank you very much, Spokesman, Mr. Chair. My colleagues actually have spoken to most of the points, but I would like to highlight a number of things. One is the case management. Case management has to be made known to people that what case management did was they responded well to the third wave. The third wave coincided with the time when we were actually drawing down. That is when we were downsizing. But as a response, they quickly reacted by actually seeking the approval of administration so that we can bring in more doctors and nurses to respond to the third wave. Hence, more admission beds were created. We created more admission beds. And then we also expanded on the home isolation. That is why people did not hear about the did not hear any noise like what we had in the first and second wave, because the home isolation architecture was expanded. Most of our positive cases, asymptomatic, were kept at their homes, and we had a team that actually visited these people in their homes to make sure that we actually gave them the appropriate care. And the case management also went out to do a survey of the oxygen facility, because that was also some noise in country about oxygen not available, oxygen being available, which was actually misinformation. The country currently has enough oxygen production that can serve the response. So the case management went out to actually identify all the centers, both public and private, that produce oxygen, so that this oxygen supply can be made available to the response. And that is what we did. And then everybody that needed oxygen was provided with oxygen. Some people, because some families decided to provide oxygen. We did not stop them, but as a response, we provided oxygen for all those that needed oxygen. I want to emphasize on local content. From the experience of Ebola to COVID, in this response, no international body, no person from the outside was brought in to tell us what to do. You can see that all the pillar leads are Sierra Leoneans. During the Ebola response, a lot of expatriates came in to actually guide our processes. We worked with our partners, but all the pillar leads actually are Sierra Leoneans, and we responded well to this epidemic. And Dr. Vandy spoke something about the seroprevalence survey that was done. I just want to throw a little light on that. That is, the seroprevalence survey just tells you that you were exposed to the virus, but you do not have active infection. You can have active infection, antibodies will be present. You may have been exposed years ago, and you can still manifest antibodies in your system. We did a survey some 5 years ago or so, and even we identified certain viruses which have not been identified in this country for over 50 years, but we found people that manifested antibodies to those viruses. Virus like chikungunya, for example, Rift Valley fever, the Zika virus, the Marburg virus as stated by Dr. Vandy, for example. All these viruses, we identified people in the mountain rural district who had antibodies to this virus, but these viruses have not been identified in people with active infection over the past 50 years. So the survey that they did just tells you that these people, it's possible, even Ebola, we identified people with Ebola, with antibodies of Ebola, even before Ebola struck, when we did a survey in the mountain rural district. So these are some of the things that people need to understand, that NaCOVERC did not underreport anything. We actually reported the test results that we do on a daily basis. So, in effect, those are the things that I wanted to add that we are doing as a response.
Thank you very much, Brigadier Professor Fodisa, for the clarity. And I think we've been able to bring, it's not always easy to have this team of experts in an emergency to bring all of them together under one roof. It's extremely difficult, but I'm sure we've been able to do this. Risk communication and social mobilization, we've been able to do this like every 2-3 months. And so we are happy that in the third wave, and as the chair indicated, that we're doing everything we can to change the directory of the epidemiological curve. We'll always get these experts to speak to us. So let us have questions from you, and I'm sure experts will be in a position to address them. Can you, who has the mics?
Good afternoon, my name is Leone Jackson. I'm reporting for CTN in Leone. The spokesperson from NaCOVERC in her statement made mention of reporting and being transparent to the public. I want to draw the attention of the person that is responsible for the vaccine. We had an information about the vaccine we spoke about, saying that South Africa donated vaccine to some West African countries, some African countries too, and European Union. And this thing happened back 3 months or 2 months ago. We only heard about that at the peak of the third wave. You made mention that some of these vaccines have been used, and so you have kept them. So we want to know why the delay of the information, and what are you going to do with the remaining that you are not able to use because of their expiring date. My second question has to do with the chairman for NaCOVERC. Of course, recently we heard about the news that we have been among some countries in the red list. And again, you are telling us that for now, the country is among the list of countries with low rates of infection. So somebody listening, you we want to know. UK is saying that we are among the red list, and then you are saying that we are among the countries that are reporting low rates of infection. So we want us to clarify that particular issue. Thank you.
Yes, at the back.
Yes, my name is Donald. I want to thank you and congratulate you, representative, for flattening the call and the style as you have put it. I just need one clarification now. That is, you said that, from what I understand, you run out of the AstraZeneca vaccine because the ones you have are expired, and you do have the Sinopharm vaccine. What the clarification we need now, can one take the AstraZeneca, the first dose, and the Sinopharm, the second dose, as the case may be? Just one last clarification. Thank you.
So we'll take two more as the first set, and we have responses.
Yeah, my name is Alhaji Said Kamara.
Alhaji, can you? Thank you. Thank you.
Directing my question to your question B, that is for the Assam Kumba, in terms of compliance and the issue of denial. Yes, there are a good number of Sierra Leoneans who have this issue of denial, and I'm sure it's as a result of the effectiveness of compliance, the issue of people to make sure that they comply with the regulation. Talking about burial, people are not complying in some areas. So I want to ask the lead, how are they going to make sure that people comply? And also on the issue of entering the airport. We have seen in other countries, people take this company very seriously. With regard or whatever you are, no longer you enter their country, they make sure that they are going to put you for 3 weeks. Okay? So I want to know whether this is also very effective here in Serra, because people are still wondering how we have the problem. Is it because of lack of compliance? That's my question. Thank you.
Thank you. So take the last for me. With your mask on, please.
Thank you so much. Mohamed Fofana from Leone, the chairman of NaCOVERC, Mr. Bangor, announced that the third wave is now under control. Maybe that means that we're relaxing some stringent measures like the ban on congregation of worship or night coffee or so. Then he also announced that data did not tell you that Sierra Leone should be in the red zone. I'm not sure whose data you are referring to. But he said the matter, you are now handling the matter diplomatically. So I don't know the importance of handling the matter diplomatically. I'm sure you have to tell us and not. Okay.
So can we have experts to respond to this? And after that, we'll have the final round.
Let me start off.
Chair would want to explain.
So, thank you. Thank you very much for the questions directed to me. Issues around red listing. So this is a decision that was taken by the UK Joint Biosecurity Centre and their committee. And in the discussions that we have had with them, at least with the UK officials here, what they were looking at from the 5th of July back 28 days was what the data that they were looking at. And they were looking at our positivity rate. They were looking at our testing capacity. They were looking at genomic sequencing because they had concerns regarding variants of concern. And in the UK, the posture is they are using predominantly vaccine as a way to fight the variants. So they had concern that our positivity rate was high for that period, and that we were not testing enough at that period, the 28 days, hence the 5th backwards. And they thought that we were not sequencing, or if we are, they said we are not uploading to what they call a GIS AID system. Professor Geba is here, I will speak to that if there is any additional information to be provided. Now, the information or the decision by the UK took effect on the 19th of July. By that date, our data speaks completely a different scenario, right? So that's really our position. Everything that we do on COVID is data-driven. The data is collected in Sierra Leone, and Sierra Leone has the responsibility to provide the data and share it internationally. So that's where we stand. So for testing, if at the date that they actually announced, they had actually taken into consideration what transpired, or iteratively had done what we call an evolution of 28 days as at that time, it speaks a completely different situation in Sierra Leone. That's basically what we are saying. So on the 19th, we had actually bent the curve. We had actually bent this curve. Our positivity rate, like I said, had actually gone past the 10% tip. Right? We are way down 4.3 or 4.5% as at that time that they went public, which was below the WHO threshold of 5%. So that's one thing we were saying. The second thing they were looking at for testing, we actually ramped up testing consistently above the average of 3% per week. We were doing over 5,000 tests per week, which is a far much more increased level of testing beyond what we were doing. And that allowed us to be able to tease out cases and force the curve to bend with additional measures. But here is the thing, which I think the public must be aware of. COVID is a very expensive virus to fight. To test is a very expensive activity. One PCR test, costs an average of $18. And let me let people know this. It's an expensive thing for a nation that is grappling to mobilize resources. It's expensive. Same so if you want to do basic antigen tests, it's expensive. Right? So we must have that in mind. They want us to test you are ideally really supposed to be testing people who turn out extensively positive that you have contact traced. That's what we are doing. And we're only responding to what the virus is displaying within our society. And we do effective surveillance on them. So that's what we have been doing. It's not, any country is not able to test all their citizens. It's not happening. And that's our posture. So our posture is, we must be, if you turn out positive and you are asymptomatic, we do the prescription to allow you to stay home. And then we'll do telemedicine on you. So that's the posture. The other thing has to do with genomic sequencing. We have 3 lab capabilities in Sierra Leone that does genomic sequencing. We have the lab in Kenema, and then we are collaborating with Leone University. They're providing support to us. We're doing sequencing there. We have a lab at 34 in the military hospital. We have genomic sequencing capabilities. The UK, they are all supporting that facility as well. We have at Joy. We have genomic sequencing. We are collaborating with the Chinese there as well. So we have the capacity in country, and we have been genomically sequencing positive cases, especially those that are coming from outside, so that we know whether we are attracting any negative, any variant of concern or of interest in the country. And so I made them to appreciate that this is the situation in the country, and we continue to do genomic sequencing. We'll cross-reference and validate our results with partner countries, the Gambia, Ghana, and Senegal. And that's how the science operates. And I think our lab uploads our genomic sequencing information internationally. It's not something that we keep at all. It is important in an environment like this that you are transparent with what you know of what is prevailing in your country. So that's why we say, as far as we are concerned, the data that we collect, that is assessed by even the ECDC and the Johns Hopkins University out there, that is rating countries that have high transmission, but also increasing case levels in the last couple of weeks. We are not in that list. Okay? Sierra Leone is not in that list, not the list. We're a low case country, as I speak right now. And as I said, by the EP data that we have in the last couple of weeks, last 28 days, we have seen a clear display of COVID-19 third wave in Sierra Leone. And I think you must have trust in the quality of the response and the institutional architecture we have in place, the integrity of the people who are managing that data, and the information we are bringing out to the public. And so that's ours. The UK had their own judgment, they did it, but we, like I said, the issue of diplomacy is important in this space because it's a matter of understanding what they did, what informed them, and what we know, and what we are carrying here. So that's basically what I think Sierra Leone people must know. We don't, in your own judgment, we are not sitting on a COVID calamity in Sierra Leone. It's not there. We don't have a calamity. We have a COVID in Sierra Leone, but people are not falling and dying in the streets. That's the truth. And to put us as a red list country is a UK decision, which we can engage in an advocacy way and ensure that there's an understanding of our data that we share with them. That's the posture. That's what I think is important for the public to know. There is a question around whether with the current pace of the curve, whether we are going to relax or not relax. That's a decision for the task force to take. But what is critical is engagement, enforcement. Because the only way what you need to do in a space like this, we need to bend and flatten. We are bending the curve, we need to flatten it and permanently flatten the curve. And permanently flatten it at 0 level as much as you can. That's basically what it is. That's a continuous process because COVID is everywhere in the world. And until it is declared over, every country is vulnerable to it. So even when you are doing measures, the measures you must be insistent and consistent in ensuring that people abide by all this advisory that we provide. Not least, if we see the need to open up, we will open up under guided advisory. But that is for a decision at the highest level after we have looked at the data. I just thought that it is important we get to the public what we have seen and what we know in terms of data which we have been observing on a week-by-week basis. And once we get there, the relevant announcement on what will be the situation will come out. But for now, we'll continue for as long as COVID is here to ensure that we enforce those protocols that we have asked people to abide by. So that at least we can be able to ensure that we balance out saving lives, but also assuring people that they can make their livelihood in a very balanced fashion. I don't think there's any other information for me. The rest I see here really has to do with the vaccine, which I think Dr. Say you want to speak to, and then compliance.
Okay.
Okay, Dr. Who goes first?
Okay, let me go.
All right.
Yeah, thank you very much for those comments. I think the first concern was about transparency in information about the AU-donated vaccines. I think first of all, the reason why the information is out there because we are talking about this now because there was this BBC report, that talked about that, and the reason why they know is because of transparency. If we did not want them to know, of course, we would not have said it. But the fact of the matter is that when those vaccines arrived in the country, it was a public program. There was a delegation from NaCOVERC Ministry of Health that went and received the vaccines. And as it was being utilized, the information was always being disseminated. It was always out there for anybody who was interested in knowing. So it's no secret at all. Understand? And we were monitoring the use of those vaccines. And like I said earlier, most of the countries that received those vaccines actually could not use them because the shelf life available as at then was extremely short. But we do not want to also be muddling in the African Union because they are one of our best friends. As I speak now, there's a delegation here. They are donating a lot of items to the country. They are helping the country. Understand? So there may have been some administrative lapses. I don't want to blame, but the fact of the matter is that there was no way we would be able to utilize those vaccines until that time. But I said that for the AstraZeneca that we got from the COVAX facility, 96,000 doses, we utilized all of them before the expiry on July 16. The other issue is about somebody taking Astra and then mixing with Sino. As far as our guidelines are concerned, your second dose is what you received as first dose. But I also want to reassure those who are due for Astra second dose that as much as we agreed as a country that the interval between the two doses was 8 weeks, but the recommended interval is 4 to 12 weeks. That is what the evidence shows, right? And the evidence also shows that even when you have a delay in getting your second dose, There is something called immunogenicity. That is the way your body responds, the immune system responds. It is even better when there is a delay. You know, not to say that we want to keep delaying, but I just want to reassure those who may have a week or two delay or a couple of weeks delay in getting their second dose, that they will even get a very good response, even not, if not even better. And then they should not be too worried about that. And so I think those are the issues that actually came up. Thank you.
Colonel Kumba, an operation? Yes. Thank you very much. Let me just respond to the concerns or comments by Alhaji Saidu Kamara. Two of them, one of which was the concern about the compliance and denial, especially the restriction on burials. And the second one, the quarantine system that we are using when passengers come in. So to start with the compliance enforcement management system that we have in place to make sure that even though people are denying, they are deniers, but we have to make sure that people comply with the funeral or the burial processions. So what we have been doing, there's a system we have put in place, which is to say that they have to come to NaCOVERC, they have to apply. When they apply, they will give us some details, and then we will call them in, sit with them, and then guide them on how they can achieve the 50%. Some of them will be grieved because of the situation, they will not be thinking properly, but we shape them, we guide them. For example, we will talk about the clergy, the number of people, we will talk about even sending out souvenirs, how they will do it. But by and large, the engagements that we have been having, they have been very successful. So most of the requests that have been coming in, we approve all because they comply with us, and they have been doing it. However, we do get information that some of the people, they will get clearance for the 50, but they think of themselves and then do otherwise. So in that case, we have spoken to the Serra Police, the Freetown City Council, and the Ward C, so that they work with us. Like I mentioned earlier, we use the cemetery officials. They have some security at the cemetery, so that if we cannot get them whilst they are processing to reduce that number, we will only allow 50 to enter the cemetery and conduct the funeral. And also we monitor the churches, because they give us addresses of the churches where churches and mosques where they conduct the funeral services. We visit those places to make sure they comply. And we rely on information from the public as well. Those ones we have been doing. On the quarantine, if the public will recall, on the 9th of June, we released a public notice where we said passengers coming from overseas to Sierra Leone, we came out with the criteria, which if they meet those criteria, we will have to quarantine them. So we were saying, if you are coming from a country that is having a variant that is of public health concern, when you arrive, we will quarantine you. Additionally, if you are coming from a country that in 14 days you have exponential increase in the number of cases, we will also quarantine you. So since then, we have been also quarantining people. There's only one country that is currently meeting that those criteria. So we have been putting them under quarantine. How we do it? When you arrive, we will take them to hotels, which they will pay for by themselves. In those hotels, day one, they will test them. So we do day 1 and day 7 testing. That is for those who do not have the 2 vaccines. But if you come, you have 2 vaccines beyond 14 days, then we will allow you to go home. We advise you to stay indoors and we'll continue to check on you. But however, if you have only taken 1 vaccine, we will still put you in the quarantine in that hotel, which is our quarantine. And then we make sure that you do the day 1 and day 7 test. And if your both results come out negative, then we will release you. We also encourage them to take vaccine, which we have been putting in our vaccine program. So in short, yes, we do have a quarantine system in our incoming passengers. We have in the country, which we do, but what you specifically want to know is the incoming passengers. So we have quarantine for that, but it's limited to people to criteria which people coming from countries that meet those criteria will have to So yes, we do have quarantine system in place, and we have been using them, which has been very successful. Thank you.
Thank you, Group Captain Kumba. We'll take the final round of questions. So first from our sign language interpreter here, and then our co. Sign language. Please ask your question in sign language.
Sorry.
Anyway, thank you very much. My question goes to Dr. Sise for the vaccination. We have over 7,000 people living with disability. So my first question is, do you have any record of any disabled person that's already taken their vaccine, whether first or second dose? And then the vaccination is more for people who are exposed. And we see like 80% of people living with disability depend on split bedding. And they go to places where like people are gathered so they can have money. And when they are going to these places, some of them don't even have masks on, they don't have hand sanitizers. And I think these people are more exposed to COVID. And when they get sick, they don't have access to medical. So I think we need to focus on them more, on vaccinating them, because if they get vaccinated, when they get sick maybe, that will be a little bit better for them. So I think we need to do this awareness raising. My office do a survey on like talking to a few of them, and all of them are saying like, we are not going to take the vaccine because we don't know. So I think NaCOVERC needs to educate these people and assure them of their safety and explain to them why they need to take this vaccination. I think we need to focus more on these people. Thank you very much.
Your hand was up? Okay, where's the mic? Come. 98.1 and our call.
Good afternoon, I am Sakti Kalon for Democracy. I want to ask so far the 1 month regulation or measures put in place since July 1st. How has it been so far? Has it been effective? Are people complying to some of the measures? And also, we are also getting to an end of that 1 month measures, which the President made an announcement to the public due to the third wave of the COVID-19. There are regulations that all of us have to follow. That's we as citizens. Are we going to continue after the 1 month end of these measures, or maybe there are going to be some flexible considerations to some of these measures? Thank you.
Thank you, Mohamed Kaba, I write for our newspaper. Thank you, Chairman and the team, for putting these reports together. But for the record, I consider the report not completed yet to be completed, because one, for the value of money and transparency, you are yet to update us on how much has so far been spent, how much you've received, and you just made mention of the fact that the PCR test is costly. That's very good, but for avoidance of another commission of inquiry, how much government is spending on PCR tests? Thank you, sir.
The gentleman just in front.
Hello, good afternoon. I'm Modan from my right for the New Citizen newspaper. My question is being directed to the chairman. Mr. Chairman, I would like to know, about a month ago, he put out a press release concerning the death relation of the vaccine to the COVID-19. It was right. The public is eager, right? We want to know what's the output. If at all, the vaccine led to the death or another thing pop up. Also, I want to know about the district level. You said earlier on that Kenema, Kono, and most of the districts in the south are doing well in vaccination, but other districts are not cooperating effectively. And lastly, to Mr. Khan, this has to do with the infodemic. Over the years, their resilience, a good number of people have a fixed mindset that no matter what the situation be, they will never take the vaccine. So what do you think needs to be done to change their mindset so that they can come in for the vaccine? Thank you.
If we have one final question, we would appreciate it. So yes, so give him, that's the last one. Yes, here, please. Yes.
My name is Ahmad Kabo. I write for the Serra Institute. I just want to share a light on an information, making rounds on social media that, did go back at Topoli Institute, have recorded three cases, positive cases of COVID-19 are on the world. So I just want to hear that.
Professor, did you get that? Can you repeat?
Three positive cases from
On the run. Okay, 3 positive cases. Yes, okay. So, can we have responses?
So, I'll start. So I'll start by just, that's a policy contribution right there. So that is well taken. It's certainly a vulnerable group that I believe must be prioritized. So we'll ensure that that is taken on board, and we'll get clearance to ensure that they are targeted. So that's thank you very much for drawing our attention. Second, compliance, effectiveness, but also review of measures. That's from Satio. So whether you have been effective, it's by what I have actually shared. The EPICOF tells you that the measures we've actually put in place the last 1 month have worked. That's the science. That's what the scientists told us. That the behavior of the curve signal that the way you have been approaching it, to have gone through the curve peak and have it down, and then the positivity rate is flattening, it depicts effectiveness. But what depicts that the measures have been effective? What is critical here? It must be sustained. It's the sustainability of that posture has to be kept continuously. We can't drop the guard on COVID. Otherwise, you'll be reiterating wave 4, wave 5, wave 6. You'll be going through this in the way you're always reversing. Yeah. So we should sustain whatever actions that or measures we have put in place, and ensure that the people are with us in the fight and abide by them. So that's one thing I would say. The measures certainly will be considered by the close of the period, and definitely judgment will be brought to see whether to relax them or not. We'll be guided by the data itself, and so I'm sure once the response has a responsibility to report back upwards, and that assessment will be done, and then we'll be advised accordingly, and will come out to the public. Critical thing is we have been engaging different stakeholders in the community, and we get a sense of their own take on where we are. So that's why we are sharing this information. Money. I didn't bring all the updates. We are transparent. We are transparent on the use of the resources that have been spent by the government on the fight against COVID. We are committed with our partners. We generally will publish every quarter, and the next publication is going out soon on the Ministry of Finance website and NPPA on the resources that have been given to us and how we have deployed them across the pillars, but also by the chart of accounts that we agreed with our accountant general on the way to present the use of the resources that we have. So the next level of public disclosure of the resources we have utilized so far in this year, 2021, is due to go up, and we'll bring that to the public, including the resources that have been mobilized within the response through testing. So that's why it can go public. I think we are open, and the next is for June ending use of resources, and the data is available. The other thing I will speak to, I am not sure what the Tonkolili case is, so I wouldn't want to speak to it, but I want to tell you one thing. If there's a positive case in Tonkolili, we'll pick it up. We'll pick it up. It will come through the lab, and surveillance will have full visibility over it, and we will trigger the architecture. So let's don't do rumors on COVID. And I will encourage the prof who is in the lab to actually speak to those. Because I think it's very important, and then Dr. Sise will take the vaccines. Thank you.
I just want to speak a little bit to cost of testing. Travelers going out of Sierra Leone are charged 500,000 riyals. That is subsidized, highly subsidized. When you are coming to Sierra Leone, also subsidized, is 800,000 riyals per person. If you just travel to England, those who have gone to England, they will tell you that they are paying up to £200 sterling per test. Yes. So if you just multiply that, I'm not in the procurement space, but just take an average of that and multiply it as against the number of tests we have done in this country, then you have an idea how much it costs to test. That every day we are testing, we have a capacity of 1,200 tests, 1,200. And let's say if we test an average of 750 a day, you multiply that by an average of 1,000, maybe $100 a day. And then that will give you an idea how costly this entire testing is all about. Apart from that, I mean, you can even go into the website to find out what the cost of an antigen test is, how much it costs. You know, this is information that is available in the internet. Just the antigen rapid test, which we will deploy very soon. We've already deployed that at the airport, but we'll soon deploy that to all the health facilities throughout the country. But that will just give you an idea. I don't know the figures. The coordinator will provide all the figures later, but that will guide you. Thank you.
Yeah. Okay, so I'll just talk briefly about the issue of the cases that were, or deaths that the causality committee had been convened. Sometimes it's extremely difficult to get that committee to meet. These are usually very busy physicians and other public health experts, but we were able to convene, they were able to meet. The committee is chaired by Dr. Afaludi, right? And I happen to also be part of that committee, and I sat in those meetings. And from all the discussions, conclusions from that meeting is that all of those cases were not found to be related to the vaccine. Of course, the deaths were highly likely, based on the estimation of the experts, to have been caused by some other underlying medical condition. But of course, the report will be finalized and submitted to chairperson, and then we'll take it from there. Thank you.
Somebody asked that there are 3 positive cases on the run in Tonkoli. So why my colleagues are asking other questions, I quickly call the DMO, Dr. Falama, in Tonkoli. So he has just confirmed to me that indeed 3 cases were on the run yesterday, but they have captured all of them. They are now in the case management. Thank you. And there's another question: how to encourage people to be vaccinated. We know vaccination is the way forward, and different countries are using different methods to cajole their population to be vaccinated. The hesitancy is not here alone; it's all over the world. Even in developed countries, we are hearing what is happening in America, in Britain, and other places. But in our own case here, there are different ways to. For example, in Britain, they are now saying if you don't have proof of vaccination, you will not be allowed to enter public spaces like in pubs, like nightclubs, something like that. So that alone is pushing the young people to be vaccinated. America also the same thing. So you need to add some incentive to it, because this is a public good. Some people don't see that. In our own case here, we can say if you are not fully vaccinated, you're not allowed to travel within. So for example, you will not be allowed to travel to uplines, provinces, or you will not be allowed to enter Uibilli. You will not be allowed to enter Ministry of Finance, something like that. That alone can motivate people to do vaccination. And this is very, very important because opening up the economy depends on our vaccination. If we are not sufficiently vaccinated to create that immunity that we are looking for, it's not going to help us. It's not going to help us. We need to open up, and people need to be vaccinated.
All right, thank you very much. So just call on Dr. Julia Spencer to just give a quick wrap-up on vaccination appeal. And after that, the chairman of NaCOVERC would wish to do a special thanks to the media for the platform you've always provided and the trust that we continue to have in you to make sure that the message goes to our people, the relevant tools to beat the third wave of the pandemic. But first, Dr. Julia Spencer, a few seconds.
Thank you very much. Two things. One, the preventive measures that NaCOVERC has put in place, masks, social distance, hand hygiene. We need to try to get people to follow those religiously. And those of us in the media should help lead that process. There is a lot of, call it denial in Sierra Leone, and not just in Sierra Leone, across the world. But we are, like I said, we are going to ramp up engagement, but the media is critical in that process. You need to help us to get people to understand why they need to abide by these regulations. Some people seem to think that, oh, NaCOVERC and government is just being troublesome. We just want to inconvenience them. The science is very clear as to these measures that have been put in place. As Group Captain Kumba has said, we are ramping up enforcement as well. Some of those beach bars and restaurants have been closed down as at the end of last week. About 9 of them have been shut down for failure to comply. Some some bars and restaurants, which are actually clubs, are masquerading as bars and restaurants. Why do I say that? Anywhere where people are dancing is no longer a restaurant or just a bar. It is a club. It is a club. So we're just going to take away the prefix night. Clubs operate now during the day and at night in Sierra Leone. So we need to be aware of that, and there are guidelines as to what should be done in those places. People just seem to think we are just being troublesome. Use of masks, social distancing, even in bars and restaurants. There is a regulation that customers should not be sitting at the bar, but people are ignoring it. Now all of this is going to be checked, and people need to understand that these regulations are going to be enforced going forward. There are 2 things that are going to help us control this virus. It is abiding by these regulations and vaccination. You also need to help us push the message about vaccination. We've said there is a lot of misinformation, and you should cross-check anything, even though you operate on social media as well. Some people who are media people are also helping to spread misinformation. So anything you see, it is easy to cross-check on whether it is true or not. So please help us by ensuring that you help us to encourage people to take the vaccine. These are the 2 things that will make us able to open the economy and remove the restrictions. If we see that we are going to 4th wave, 5th wave, we don't want that to happen. Please help us. Thank you.
Spokesman, there was a question addressed to me. What would I do if somebody was adamant that he or she would refuse to take the vaccine? I'll only answer that question with one quotation from Dr. Sanjay Gupta of CNN. He said that to die of COVID now that there are vaccines. It's like allowing yourself to die in a war after the peace treaty has been signed. So this is a peace treaty. Take the vaccine. That's the peace treaty with the land.
Chair of NaCOVERC, for the duration of the response, NaCOVERC has worked closely with the media in Sierra Leone. We know one of those features happens to be the /IRN platform that we're going to misuse. The press is here not merely because COVID-19 is an issue, but as an enduring feature of the partnership that we have with them. On that note, you may wish to move a special vote of thanks to speak to that, Chair.
Thank you very much. Let me start by truly appreciating our engagement with Port Estate and the media community. They've been out there with us since the beginning, and they continue to engage. We've been using the IRN to reach out across the country. We continue to appeal that that particular platform is made available to us, and we commit as a response to be very cooperative with your engagement. We value what you do, and we will ensure that we keep that relationship solid going forward. But let me just close by just saying for the public that we are very pleased with the response effort against the third wave. Sierra Leone currently, we are confident that we have bent the curve for the third wave. And we encourage our people to continue to abide by the measures that we have pronounced to ensure that we flatten that curve and keep our case levels as low as possible and keep them even zero in a very continuous way going forward. We encourage you to continue to face mask, abide by the measures we have put for social distancing, avoiding super spreader events, and ensure that you keep minimum number of people in crowded places. Wear face mask, ensure that you wash your hands with hand sanitizer and soap very frequently, and avoid being in crowd as much as you can. If you are out in the public, make sure that you wear your mask. If you are out in vehicles, public transportation, make sure that you wear your mask. The vaccines are out there. It's the most potent arsenal that we have to fight COVID. We'll continue to deploy our public health architecture. But as a people, we must ensure that we do take the vaccine. The science has proven that people who have taken the vaccines don't die of the virus. You may get sick, but you will recover, or you may not get sick too terribly. So if you don't take the vaccines, we have seen in many countries that those who don't take the vaccines are the ones that are catching COVID now and dying of it. So we do have vaccines in the country. We are ramping up to do what they call emergency rush delivery of vaccines into the country. And we are increasing on the arsenal of vaccines that we'll be getting. But we'll encourage you, the Sinopharm vaccine is in the country in large numbers. We encourage people to take it. Take the vaccines, they are good. Sinopharm has been proven to be good for any age category in the world, any age category. So even if you are above 60, take it. It is working, and it's working for other countries. It must work for us. Let's protect our people, let's protect the life, let's fight this pandemic together. I want to thank you very much.
Thank you. Thank you very much, Chair. Thank you. And I say thank you to my colleagues and our team of experts for coming. See you again next time. Thank you.